So, a very good morning, sir, to all the admin doctors. Thank you so much for joining us for today's webinar. Never is to once appropriately vaccinated. It's innovation to serve the society and humankind. The topic of the webinar, dosage reduction strategy in rabies management, role of naval vaccine. Dear doctor, rabies is the world's first novel three-dose anti-rabies vaccine. So, novel three-dose anti-rabies vaccine. And with great pride, we would like to inform you that rabies has successfully completed 1 year of launch, with more than 40,000 animal bite victims being vaccinated. 100% compliance was recorded, and no case of ADRS was registered. Yeah, I'm audible.
Yes. Yes.
Okay. So with this, it is my honor to introduce to you the speaker of today's webinar, Dr. Mahesh Prasad Pandey, sir. So from Harpriya Clinic at Ram Bank Choraha, practicing at since 30 years. Yeah. So have a good experience about, and now I would like to request Dr. Mahesh Prasad Pandey, sir, to initiate the talk, and later on we'll have a question and answer session. So over to you, sir.
Thank you. शेयर तो चल ही रहा है पीपीटी जो है इसको इसी को सर आप स्टार्ट कर So this vaccine Thravis, this forms bridge between our pets and us. So there is safety which is provided by Thravis. Many vaccines are available for protection from rabies, but this novel vaccine has been introduced 1 year before, and this requires only 3 doses, and this gives 100% protection. So let's start the presentation. These are the contents. Although the list is long, but the content is small. Rabies disease, first of all, we will talk about rabies disease and animal bites incidence in India, epidemiology, evolution of rabies vaccine, changes, the unmet need, introducing Thravis of novel technology, clinical study phase 2 and phase 3, and lastly, takeaways. So this is about the rabies virus. Rabies virus, this is the rabies disease is a zoonotic disease. Zoonotic disease means the disease which is spread by animals to the mankind. And this is caused by rabies virus, which is a rhabdovirus. It is a bullet-shaped virus. It, like all the viruses, it contains a coat, envelope, and a core containing nucleic acid, RNA. It is RNA virus, and this is encoded with 5 structural proteins. The outer one, M protein or matrix protein, which forms the envelope, and out of this there are spikes containing G protein or glycoprotein, and in the core there is viral genomic RNA, that is nuclear protein, and it also contains P protein, that is phosphoprotein, and L protein. L protein, large protein, or viral RNA polymerase. And on the foot, just see, G protein is the major antigen in the formation of neutralizing antibodies against the rabies virus. So G protein is only required for the protection, for the formation of the uh, vaccine. This is the epidemiology. If you see, there are around 60,000 deaths per year all over the world. And out of these 20,000 rabies deaths per year in India only. So India is the world capital. 91% deaths are in rural areas, not in urban areas, in the rural areas. These data are highly underreported because most of the data they are most of the deaths, most of the data they are not reported to the authorities. So these data, even this may be a tip of the iceberg. The major problem may be very high, but even then, seeing this, uh, in India we have got a major problem, uh, major proportion of deaths by this rabies. No, rabies is a fatal disease, 100% fatal disease, we all know. But we also know that it is 100% vaccine preventable disease also. So this is very important, that a disease which is 100% fatal without vaccination, once it is developed, it is 100% fatal, there is no treatment. And but it is 100% preventable if we intervene in the time. This is the evolution of the rabies vaccine. So before going to the evolution of the rabies vaccine, I would like to go uh, in the history of vaccine development. The first ever successful vaccine of the world was that of smallpox, and it was created by Dr. Edward Jenner, who was a British doctor. And in the history, in the May 1796, he inoculated 8-year-old child James Phipps with matter collected from a cowpox sore on the hand of a milkmaid. It was based on the observation that the persons who developed cowpox were immune to smallpox also. And after the inoculation, the child fell ill, but he recovered after 15 days. And after 2 months, in the July 1796, the patient was also again inoculated with that the person, the James Phipps, was also inoculated with the matter taken from the human pox, sore of the human pox, and he did not develop the disease. So he was found to be immune of smallpox also. So the cross check was done. So the first vaccine was discovered. In the Latin, how the vaccine word is discovered? In the Latin, cow means vacca, VACCA, and by the name of vacca, vaccine word has been coined. Uh, Now come to rabies vaccine evolution. On July 6, 1885, Louis Pasteur and his colleagues injected the first ever 14 daily doses of rabies vaccine, which was prepared by rabbit spinal cord suspended in the saline. And this was inoculated to a child, 9-year-old child, Joseph Mister, who has been severely bitten by a rabid dog two days before, and the child survived. 14 doses, they contain material in increasing viral doses, increasing viral load. Right. So slide, if you go, this live attenuated vaccine in the spinal cord of rabbit, and this was non-standardized dried preparation. This was a neural vaccine first used by Louis Pasteur, And second vaccine developed in the after many years, brain vaccine, which contained 10% of brain material and minimal neural content. It was liquid preparation. 14 इंजेक्शंस वेयर गिवन. और इसको बचपन में हम लोग पढ़ा भी करते हैं, बचपन में हम लोग कहा भी करते थे कुत्ते को मत छेड़ो, अगर काट लेगा तो 14 इंजेक्शन पेट में लगेंगे. तो ये वही वैक्सीन है. So these two vaccines were nerve tissue vaccines, and after many years in 1976, the cell culture vaccines were developed. Many cell culture vaccines are available nowadays, which are given in 5 doses. 5 doses are 0, 3, 7, 14, and 28 days. Human diploid cell vaccine, chick embryo vaccine, duck embryo vaccine, and Vero vaccine. So many vaccines are available nowadays, and they are all 100% effective. So any of the vaccine can be chosen, and they are commercially available in powder form, which are reconstituted at the time of injection. So they are given intramuscular. But nowadays, WHO has recommended subcutaneous, intradermal doses also. These are the current challenges with 5 doses vaccine. The current vaccine are cell culture vaccines, so no, there is no problem. Second is inactivated vaccine are 50 years old technology, no problem. The problem is decreased compliance beyond 3 injections. This is the major problem. Patient is motivated for taking 3 injections, but last 2 doses, there is decreased compliance. So there is inconsistency in potency, stability, and short supply, adverse events. ये तो खैर इतने प्रॉब्लम में नहीं है, but the main problem is decreased compliance. Current challenges, non-compliance is a major issue after 3 injections. So meeting the unmet need, introducing a novel vaccine with simple and shorter regime. And this is the technology. This is first protein subunit vaccine. इसमें क्या किया है, जी प्रोटीन को, ग्लाइकोप्रोटीन को आइसोलेट कर लिया and prepared by VLP platform technology. First vaccine with 3-dose intramuscular regime, 0-3-7 days. So only 3 doses, so it is better compliance due to easy to follow regime and less visits. Convenience, ready to use, no reconstitution is needed. It is provided in ready to use form, liquid form. So just put in the syringe and give intramuscular. This is the VLP technology. See the first figure, virus, natural virus, native virus, and the last figure, VLP as vaccine. The VLP does not contain viral RNA. Just see. VLP does not contain viral RNA. So G protein, it is isolated, and by recombinant gene technology, the virus-like particles are made, and these have similar efficacy just like native virus. But since it does not contain RNA, so fear of developing rabies is not there. So that is the advantage. There is no viral RNA, so it cannot replicate. So this is the article. This is the original research article of VLP technology. You can go through this. This is a clinical phase 2 trial. In this trial, a bit detail. 5 types of patients were inoculated by these vaccines. Study design was 50-50 patients of each. This vaccine were given 10 microgram 0-3 dose, 10 microgram 0-3-7 days, 3 doses, or 50 microgram 0-3 dose and 50 microgram 0-3-7 dose. And the fifth subset was was that of Rabipur with 5 doses. So if you see the second figure, up to up to 90 days or 3 months, the immunity or zero protection is the same, 100% zero protection by 90 days or 3 months. After 3 months, zero protection slightly reduced in 03 doses and 037 doses to hours. And the other three vaccines, 50 microgram, 03 and 037 and Rabipur, having same potency, they were providing 100% zero protection. And after 9 months, after 6 months, these three were providing 100% protection. And after 270 days or 9 months, the potency of 50 microgram 7 dose is 100, still 100%. So it is very effective vaccine even after 3 doses. Even potency of Rabipur has decreased after 270 days or 9. Study phase was this study was to see the effectivity of the vaccine, and this study, phase 3 study, this was to see the this was to evaluate the immunogenicity and the safety of rabies G vaccine administered as a simulated post-exposure immunization in healthy volunteers. So randomized comparative controlled multicentric study. Total 800 subjects were taken and randomization was 2:1. The study design is 037 days regime of Thravis and having 533 subjects and 037, 14 and 28 days rabies Rabipur vaccine was inoculated in 267 subjects, and the results to demonstrate non-inferior, and the study objective was to demonstrate non-inferiority of the test vaccine to the comparative vaccine. Primary objective was to see the efficacy. Subjects were with zero protection at 14 days post first dose. Zero protection means and rabies virus natural antibodies equal to or more than zero point 0.5 IU per ml. This was the target. And secondary objective was subjects with zero protection at 42 post first dose or test vaccine and safety by monitoring subjects with adverse events. So these are the results. If we see efficacy at 14 days and 42 days, the efficacy is almost similar. So there is no inferiority of the zero protection of primary endpoint at the day of day 42 were met. Test and comparator are identical in zero protection rate both by days 14 and 42. And this safety data. Safety data, see the adverse effects. There are much less side effects in the rabies. The second one is local adverse effects. See, the local adverse effects are also less. In this, there are swelling, pain, and in third slide, third figure, Yes, there are much less cases developing fever, ear pain. Some subjects develop ear pain. Headache was much less. Urticaria was developed in few pains, and the joint pain was not there, and nausea was not there. So there are very less side effects with this vaccine as compared to uh, the reference vaccine. So this is the study conclusions. Rabies was non-inferior to the reference vaccine. यानी जो 5 डोज वैक्सीन है उनसे किसी भी मामले में ये कम नहीं है. तो इफेक्ट इज द सेम. There are less adverse effects compared to the reference vaccine, and the most important advantage is now it was safe. ये बंद आगे हाँ, अब ये चल रही कि नहीं, देखो आ रहा है, राइट. So the main advantage of this vaccine is novel 3-dose Thravis was found to be safe, immunogenic, and was comparable to 5 doses of WHO pre-qualified vaccine. These are the awards. Pharma Innovation of the Year by Economic Times and Golden Globe Tiger Award, Malaysia for Innovative Product of the Year. Thank you.
ओके सर, थैंक यू. सर एक बार मैं देख लेता हूँ किसी का कोई क्वेश्चन होगा ऑडियंस में से.
इसमें मेरा फोटो डाल दो, इसमें आएगा, ऐसे ही चलता रहेगा, ऐसे ही रहेगा.
हाँ वो एक्चुअली वो स्क्रीन चल रही है अभी, बस सर 2-3 मिनट तो वेट करेंगे, अगर कुछ क्वेश्चन पूछ सकते हो.
If any questions, you are welcome.
Sir, I wanna ask one question. How does one treat an animal bite?
How does? Hello, how does?
I'm asking
Please,
that how does one treat an animal bite, sir?
how does?
One treat an
Please,
animal bite.
please repeat.
Sir, how does one treat an animal bite, sir? Actually, I have two
Animal
questions,
bite.
sir. Sir, suppose yes, sir.
Huh. The first question, how do you treat the animal bite? First of all, wash the wound with plenty of water and soap for at least 15 minutes. If soap is not available, plain water is also sufficient. That is the thing. And then apply some betadine on the wound. If suturing is required, it is better not to suture it, but if it is required, loose suturing is done. But after giving rabies immunoglobulin, infiltrating the rabies immunoglobulin in the wound can be sutured, but loose suturing is done. That's all. What is the
Thank you
second
so much.
question? What is the second
Sir,
question?
second question sir ये था कि अगर कोई dog bite cases होता है, anti-rabies vaccine, and how much days of efficacy is that?
If you get 3 months, efficacy is 100%. And after then, the efficacy slightly reduces. But in the study 2, phase 3 study, I have shown that the slide has shown that efficacy is maintained up to 9 months in this rabies.
Okay.
But
Thank
the
you so much, sir.
conventional vaccine, 5-dose vaccine, after 3 months, booster dose is required.
Okay.
Post-exposure vaccine, post-exposure vaccination, who are already vaccinated, post-exposure vaccination, that is 0 and 3 dosage, 2 doses, 0 and 3 days is required after 3 months.
Okay. Thank you, sir.
So, thank you so much, sir. Dr. Mahesh, sir. for the informative talk. We truly appreciate your effort. Last but not the least, we would like to inform you that Thaddeus has won two prestigious award in innovation category. Elite Award, Elite India Pharma Award, and Golden Globe Tiger Award in Malaysia. So,
Thank you.
with this, sir, thank you so much, sir, from our Kerala team.
Thank you. Thank you. Thank you.
Thank you. Thank you, sir.
थैंक यू सो मच सर।
थैंक यू सर।
सर बहुत अच्छा
क्या
रहा।
तेल फैलाया
हाँ सर।
तेल फैलाया
हेलो हेलो सर, मीटिंग एंड कर दूं? हेलो हेलो।